The Johns Hopkins Wilmer Eye Institute. The Wilmer name is recognized the world over for excellence in ophthalmology. Wilmer's storied history, nearly 100 years in the making, includes many of the most distinguished physicians and researchers in the field, along with many of the biggest breakthroughs in diagnostics, treatments, and top-of-the-line patient care. Wilmer is strategically located within Johns Hopkins Hospital, itself a medical and scientific powerhouse. Its facilities, including breathtaking Sheikh Zayed Tower, home of the only designated eye trauma center in the region, make Hopkins an ideal setting for this top-ranked ophthalmology program. Johns Hopkins is located in the heart of historic Baltimore, Maryland, a bustling waterfront metropolis that is home to world-class museums, theaters, sports venues, and breathtaking parks. As the largest eye hospital in the United States, there's a lot to see at Wilmer. So let's get started. The lobby of the Wilmer Eye Institute is an exciting place to be. Wilmer's wide referral base includes patients from all over the Eastern Seaboard, as well as from around the world. The lobby's museum-quality exhibits of early ophthalmic equipment emphasize Wilmer's rich history in ophthalmology and serve as inspiration that as a resident at the Wilmer Eye Institute, you are part of something bigger. The Edward A. Momini Building, located on Johns Hopkins East Baltimore campus, is home to Wilmer's subspecialty clinics, many of which are the largest of their kind in the country. In the clinics, you'll see very rare, complex pathology and learn how our attending physicians utilize evidence-based medicine in the care of these patients. As a resident, you'll rotate through the 8 subspecialties, including cornea, glaucoma, retina, uveitis, pediatric ophthalmology, and strabismus, neuro-ophthalmology, and oculoplastics. Each subspecialty has its own division education champion, DEC, a faculty member dedicated to resident education in that subspecialty. The Patient Access Center for the Eye, PACE, is a teaching-focused continuity clinic where residents follow their own patients throughout their 3-year residency. As your patient's primary eye care doctor, you will help them get the treatment they need. Each exam room features a slit lamp with a side scope, which allows the attending physician to view what the resident is seeing, and vice versa. PACE also has its own visual field machine, OCT machine, and Pentacam. With its own technician support, PACE is an efficiently run clinic where residents can hone their exam skills, generate surgeries, and begin to explore advanced pathology with gradual autonomy. During their first and second years, residents in the Center of Excellence for Ophthalmic Surgical Education and Training, or OFSET, work closely with faculty to develop their microsurgical skills through a structured wet lab curriculum. The newly renovated state-of-the-art wet lab, with a full-time wet lab administrator, boasts 7 surgical microscopes with recording abilities, plus an instructor station and a computer-based simulator, where residents practice surgical skills on animal and human eyes. OFSET is also the setting for courses on such topics as small incision cataract surgery and minimally invasive glaucoma surgery. The Robert H. and Clarice Smith Building, just across the street, houses 5 floors of world-class research facilities. Wilmer, a research powerhouse, is #1 in NIH funding in the nation. Each resident receives funding to conduct their own research project and is matched with a faculty research mentor. Residents are strongly encouraged to publish their work. Smith also houses a world-class ophthalmic pathology lab, where residents gain hands-on experience with surgical pathology in their second year. The beautiful, light-filled Smith atrium makes a great setting for some of the lectureships at Wilmer. Also located within the Smith Building is the Ben Dan Surgical Pavilion, our state-of-the-art center where residents perform the majority of their surgical cases. The center features 8 dedicated operating rooms and its own surgical staff, technicians, and anesthesiologists focused on ophthalmic surgery for both children and adults. The Patz Lecture Hall, named for former Wilmer chairman Dr. Arnold Patz, is where the entire department gathers on Thursday mornings for grand rounds. As a resident, you'll work closely with faculty to identify interesting cases and hone your presentation skills. At Wilmer, the world's leading experts are often in the audience and have done research on the topics being presented, so it's always a lively discussion, often with some of the biggest names in ophthalmology. Grand rounds is followed by 3 hours of dedicated teaching in a clinical specialty. Wilmer is home to over a dozen pioneering research centers, including the Center for Nanomedicine, the Center for Stem Cells and Ocular Regenerative Medicine, and the Dana Center for Preventive Ophthalmology. The Dana Center, founded by Dr. Alfred Sommer, is a leader in global and domestic research on blindness prevention and the only World Health Organization collaborating center in the U.S. Interested residents can conduct research in any of these centers under the mentorship of faculty members. Johns Hopkins Downtown Emergency Department, or ED, features the only Level 1 eye trauma center in the region, so Wilmer residents see one of the highest volumes of eye trauma in the country and learn how to manage the most complex cases. Wilmer's ED eye room features a hybrid non-mydriatric fundus camera and OCT machine. Residents see many of their inpatient consults in Johns Hopkins Sheikh Zayed Tower. This elegant, state-of-the-art setting, designed to marry the needs of a teaching hospital with the latest technology, is also where residents and attending physicians perform inpatient surgical procedures on patients too sick to be operated on at Bendan. The trauma exposure you'll get as a resident at Wilmer is unparalleled. At Johns Hopkins Bayview Clinic, a community hospital with a designated burn center, residents learn how to manage complex ocular injuries associated with facial burns better than in any program in the country. Residents get an early and robust laser experience in the refractive laser suite at Green Springs Station, one of Wilmer's satellite locations. At Green Spring, first and second-year residents perform both LASIK and PRK surgeries, which adds to their cornea experience. During clinical training, residents also operate in Green Springs Ambulatory Surgery Center. Located in the leafy suburbs of Baltimore, Green Springs Station features coffee shops and a park-like setting. Every weekday morning, first-year residents join their Assistant Chief of Service for morning rounds. Morning rounds represent an opportunity to discuss complex cases and examine patients bedside, making for a high-yield learning experience. On Wednesday mornings, professor rounds are held in the 7th floor conference room. Residents present to Wilmer Chair Dr. Peter McDonnell on their topic of choice. Prior topics have included ancient artists with eye problems, advocacy in ophthalmology, and even space ophthalmology. It's a time when residents can really interact with the chair and get to know him, which is pretty special. It's also an opportunity to get a global career perspective of the field. It's your one-on-one private time with the chairman. The Resident Lounge is a place where residents can gather informally to take a breather between patients or catch up on work. Other areas to relax include Balducci's, an upscale on-campus eatery which features made-to-order sandwiches and salads, gelato, and great coffee, as well as a beautiful courtyard. A nearby Starbucks is the go-to spot for a quick off-campus break. The Friedenwald Library of Ophthalmology, staffed by a full-time librarian, is a superb ophthalmology learning resource center. Wilmer also has its own machine shop, with a full-time staff that is always ready to assist you with all of your equipment needs, as well as a dedicated print shop to print your research posters. The Johns Hopkins Wilmer Eye Institute provides an unparalleled, comprehensive residency experience. Wilmer alumni routinely cite the dedication, teaching, mentorship, and approachability of our faculty as having been instrumental in their residency and their career trajectory. The experience you'll get and have as a Wilmer resident will stay with you for the rest of your life.